lymphatic metastasis. Okay? 57 years old, 11 June 2018, comes to me. The disease started in 2016. For 8 years diabetes on diabetes medicine, for 2 years on hypertension, persistent increased PSA, started allopathic medicine, but levels could not be maintained, passing feeble stream of urine, goes to a urologist, doctor advises removal of the testes, which he does on 4th of June 2018, followed by severe pain at the site of operation, and these are his PSA levels. So you will see February 16, September 16, March 17, July and December. So fluctuating, correct? Not a persistent, but this is very high, the last one 33. He also has left renal calculi, pre-void 214, post-void 106, prostate enlarged, borderline, right kidney, cyst in the lower pole. This was in April 17 USC. In December 17, when he comes to me, these are the cholesterol report. Creatinine is already high, 1.7. A1C is high, 8.1. And these were his PET scan in May 2018. I don't know how much I can you all read? I don't know. It's very small, but I don't know. I cannot enlarge it for you. But so it says prostatic specific membranes antigen express, lesion involving prostatic predominantly right half, suggestive of primary neoplastic pathology. Okay? PSA is 86 in May when I start treating him. Past history of tuberculosis when he was 13 years old. Very bad history of diabetes in the family, very bad history of cancer in the family. 2 people had cancer, most of them had diabetes. Not a very good family history. Appetite is good, thirst is thirstlessness. Love for pickles. Feeble stream, takes time to pass urine, goes to toilet every alternate day to pass stool, sweat while eating, very chilly patient, sleeps on right side, sleep is disturbed by light. This is the history. Now the mind. Very easy going. Doesn't fight with anyone, avoid situation which will cause fights and quarrels, very low self-esteem, likes people around him, very shy person. All brothers share the same business. After the death of the elder brother, sister-in-law wanted to separate from business. They started asking their business share and money. After giving share, they weren't satisfied and asked for more money. Even after giving expected amount of money, they started torturing him. Understood? To avoid fines, he gave whatever they asked, including the house in which he was staying. Now there is no place for him to stay. Hence he buys a new house on loan. He feels he was wrongly blamed despite giving everything that was asked by his sister-in-law. His business was going through thick and thin. Supplies were unfaithful to him. Goods weren't delivered on time. He had to handle everything on his own. Business was not going well. And he believed someone was doing black magic on him to make things worse. That's how the cancer started in his life. He went, got his testes operated. Then doctor said, now the second treatment is chemotherapy. He takes first cycle of chemotherapy and severe diarrhea comes. He leaves chemotherapy. Doctor says, you can't do that because you still have cancer in your body. He decides not to take it and he comes to us for homeopathy. Understood? Low confidence, delusion persecuted he is by the sister-in-law, delusion tormented he is by sister-in-law, timidity, thirstless, alternate day stools, retarded urine, cancer prostate gland, sleeps on right side, sleeplessness from light, sweat while eating, cancerous affection of the bones, cancerous affection of the glands, diabetes, family history of cancer, past history of tuberculosis, likes pickle, hypertension and softening of the bone. This was the repertorial rubric which I converted. Nice smile, huh? Lazy. Your rubric is laziness, not writing down. Right. Your handwriting will improve. Okay? So this was the totality. This was the totality. And Conayam was prescribed on the following symptoms. Can you see? These were the symptoms of Conayam. Why so hot? Why you keep air conditioner on 20? Make it 10. I'm sweating. That's why I was wondering. It's okay if you can't find it, forget it. Huh? Good. Make it less. This is the less? Yeah. Oh, good. Another one also. Hey, 20 पे मत रखो यार. तुम्हारा तमिलनाडु का गीत बहुत खराब है. Okay, good. बैठो. Okay. So Conayam 3C. Now why 3C? Because of so much cancer in the body. Susceptibility is very poor. Why? He has diabetes, he has comorbidity of hypertension, metastasis, cancer, left the treatment halfway. When comorbidities are there, please don't give a higher potency. And along with that, I give Terminalia cellula 9x as a tonic, which I give to many cancer patients to improve the nutritional value, because his appetite was not very good and he suffered from side effects of chemotherapy. So we started in July 2018, but he had, as I told you, severe diarrhea, and I told him if diarrhea doesn't come under control with conayam, please take arsenic alb 1N for some days and then start conayam. But if it comes under control, well and good, don't take arsenic. So that was the prescription. As you can see, for 1 month, hemoglobin 10, PSA was, can you see? It came down to 1.42 just with 1 month of conayam. Okay? No allopathy was ever given. He developed swelling of the right feet. Feeble urine is still there. Pain at the operated site is better. Continue conayam with Terminalia. After 3 months, swelling is better, but now he develops fever. He had cold water 5 days back. Can't tolerate covering. Cheeks are red during fever. Blister in the mouth during fever. White colored mucus in the throat. Cough waking from sleep, during sleep, rising from bed, better by drinking warm water. Cough disturbing sleep, appetite reduced. Severe weakness with fever. Head hot with fever. Nose obstruction night. Sinusitis, retching cough, feeble stream of urine is better. No pain at operated site. But a big infection comes in a big way. Better you repetize. Taking this following rubrics, as you can see. Same thing what I read, I converted this into a rubric form. There were 20 rubrics which I took for this case. And what would be the remedy? Yeah? Cough, sleep during, going on to warm drink, ameliorates, catarrh, bitter taste during fever. Nux vomica, this is a typical Nux case. Nux vomica. Which potency I should give? Mother tincture? No. Then 1N, 10N, 30. The case is severe, no? Better start with 200. 6 hourly for 2 days. Don't give for many days. So there is still cough, but no fever. That's a good sign. Nausea looking at the food. Now that was never there. It comes new. So this is a new symptom. Try to put that in the remaining symptom. And then what you will get is colchicum. So after Nux we give colchicum for 7 days. Everything is better, but it's not 100% better. So continue colchicum till all the symptoms go. Now no cough, no nausea. So good sign. Had 1 episode of fever 3 days back. Again after colchicum. Hemoglobin was 7.5. So again still something is wrong, otherwise fever should not come back once it has gone. Again make a new totality with the remaining symptoms. Internal heat, appetite wanting, anemia, convalescence after chemotherapy, weakness. This was the totality. And again arsenic will come because these are all symptoms of arsenic. As you can see, arsenic 3C, 8 hourly. No fever, bitter taste better, weakness better, appetite better. Patient is taking 5 units of injection insulin for diabetes. Still, we have not stopped insulin so far. Hemoglobin is 6.8, BP is 260. Continue arsenic for 7 more days. Overall much better. But tasteless in the mouth is still there. So till all the symptoms are not better, don't stop your acute. So continue arsenic. His hemoglobin level was very low, so we gave him 2 pack cell volume. No fever, but weakness is there. Altered taste in the mouth is there. Creatine jumps to 2.3, but hemoglobin is better because we give transfusion. Still not better, so continue arsenic 3C. Now he gets a knee pain after arsenic. Bitter taste in the mouth comes back. Weakness in the knee. Appetite is not better, but weakness is better. Hemoglobin is now 9.5 without transfusion. Now you see the diabetes, which was 9 point something, has come down to 6.7. Creatine is 1.7, EGFR is 43. And I thought better do the PET scan, and the PET scan says reduction in the metastasis. Okay? Yellow one shows reduction, same laboratory, same place, same hospital. So we started in July. By November the metastasis started regressing. But we have to cure his diabetes, we have to cure his hypertension. When a case of cancer comes, don't be very happy if cancer is better. You are not a good homeopath. All the disease should get better. Because we are not treating symptomatically somebody. Yes or no? Mm-hmm. In allopathy, you give medicine for hypertension, only hypertension will get better. Diabetes will not get better. But in homeopathy, when you give a medicine, everything should be better. And so you will see all this yellow line shows major improvement in all the metastases, but I will read for you. So significant in metabolic activity, in prostate gland, decreasing the size of right orbital nodes, resolution of metabolic activity in the lumbar spine, all the bony metastases are better, decrease in metabolic in the right common iliac, continuum unayam. Now, my question is, why is developing so many acute illnesses one after another? What part of organon is this? And how will you explain it? Yeah? Huh? Now don't talk amongst yourself. Talk to me. I will help you. Why is he getting so many complaints? He started with cough and cold, then the nausea business came, then the knee pain came, then again the fever came. Why? Come on, make an attempt. Huh? What activity?
Like you said in the previous case now.
What?
Patient was getting immediate KFC.
Tension is getting. That is the answer of this lady. Idiosyncrasy. Sorry, susceptibility. Yes, partly yes. But every time we can escape giving one reason. Huh? There has to be another reason also. Come on. When you are treating somebody, new and new symptoms are coming. मायाज़म किधर से घुसा?